You're listening to Play Therapy Community Podcast, Episode 54.
Welcome to Play Therapy Community Podcast, providing connection, information, and inspiration to child therapists all around the world. Here's your host, a licensed psychotherapist, a registered play therapist, and my mom, Jackie Flynn.
Hello, everyone. Jackie Flynn here. Thanks again for meeting us on this Play Therapy Community Podcast. I am super excited about today's episode. Today, I have a very special guest. Her name is Lucy Lauer. She's a licensed mental health counselor with 26 years of experience as a registered dietitian. So she has really a unique combo there. I recently met her in person, but I knew of her in our community for a long time, and she's just wonderful. She specializes in helping people navigate through the rough waters of disordered eating to achieve a healthier life and relationship with food. She has experience with anorexia nervosa, bulimia nervosa, binge eating disorder, nocturnal eating disorder, and a range of dysfunctional eating patterns that cause distress but may not reach that diagnostic level. She's wonderful, and she's such a great resource. I send people to her frequently in my community. I'm lucky to be in the same community with her. In 35 years of practice, she's treated disorder eating from both a nutritional and a psychological perspective. She's presented workshops at the local and state and national levels on many aspects of disordered eating for psychologists and counselors, physicians, dietitians, parents, and teachers. She has information for everybody. She's established and facilitated the Space Coast Eating Disorders Professional Consortium from 2009 and 2011, and she supervises Florida Tech psychology students in a special practicum focused on eating disorder treatment. And I'm located here in Central Florida, so it's just really neat to have access to someone with such unique array of experience, and she's just wonderful at what she does. She participates regularly in continuing education programs, and she has had over 60 hours of specialized training in eating disorder treatment in the last 3 years alone. Specific topics have included ACT and other evidence-based interventions, medical complications, trauma impact, co-occurring disorders, substance abuse, self-injury, things like that. Assessment for appropriate level of care, body image, art, and other expressive therapies. And she really uses that team approach. I know when, I've shared a couple of clients with her or contacted her office, and I was able to actually reach out to the dietitian that she has on board there too. Just really professional, really, really good stuff. She's been invited to site visits at residential treatment centers such as South Florida and Colorado. She really knows our stuff. So I feel like I just talked her head off, but I could just talk about her all day. But I just want to thank you so much for being on the show, Lucy. It is an honor to have you here.
Well, thanks for having me.
And today, what we're going to talk about is really just looking at eating disorders and that fear of recovery. I know you do some group work and individual work, and you train other clinicians. You just kind of do it all.
Well, that's definitely a mouthful, but yes, I do think that my training as a dietitian with a scientific background is a great asset in helping people understand not just the psychological challenges of these disorders, but also the physiological underpinning that must be addressed for these folks to fully recover. And so I think that I do bring that extra piece to the puzzle that that can help all of us who work with these people help them recover sooner and more thoroughly.
Yes, yes. And I know just a second ago I said fear of recovery because that was something I wanted to include in our conversation. But actually, what we're going to talk about, and I know there's so many things that I just wish that I could insert all of the knowledge from your head into my head. But specifically, we're going to talk about the profound impact of group therapy with eating disorders. And I know you facilitate an amazing group in our area, and it has been such a positive influence on people's lives. So I want the clinicians out there that work with children and families just to really kind of get a taste for how group can help people with eating disorders.
Well, one of the things about eating disorders is that they are very isolating. There is a profound shame that comes with eating disorders, in part because they are not very well understood by family, friends, and even a lot of caregivers. And they have been underground for decades. And a lot of people who come into treatment may have had their eating disorder for, upwards of 30 years. Mm-hmm. And so one of the benefits that all of the members in our group have voiced is the fact that there are other people there who can say me too, yes, who understand the isolation and the shame and the self-hatred and the body hatred that feels so ingrained with their actual personality that it's hard for them sometimes to even imagine a life without the eating disorder.
Yeah, it becomes part of their identity, I think. They kind of define themselves by it.
Yes, and so then it's very difficult to let go of it. And you'd mentioned the fear of recovery, and part of that does have to do with, if I don't have my eating disorder, then who am I? Mm-hmm. For some folks, the eating disorder creates a sense of specialness, and they have a fear that if they lose that, then they will be a nobody. They'll be invisible. And also the challenges of self-acceptance and healing from years of denial of what the body actually needs, can be very frustrating and hard to understand. And so having people in a group who share these experiences and not only can say me too, but also share ways that they have dealt with certain aspects of it, because as you probably know, they're very complex. Mm-hmm. They're between the physiological piece and the psychological piece, and then you have the interrelationships and the between family and other relationships. They get very complicated, and so some people do better in managing certain parts than others, and so when they come together, they can help each other learn and grow in a very safe and understanding environment.
I think that the part that I really caught on to, that part is that safe environment where they don't feel judged, because with that sense of shame, it can take a lot of courage to share those vulnerable things that you're so very ashamed of, or feeling bad about your body image or your habits or what you've done. And when you have somebody there that not only is accepting and caring about what you're saying, but also is experiencing it, it can be really profound. It can be amazing.
It is. But one of the things that we know about eating disorders, too, is that there are certain aspects of temperament that are risk factors for eating disorders. And as you know, temperament is inborn. And one of these is interpersonal sensitivity. Mm-hmm. And so folks with eating disorders, just by nature of how they were born, are very sensitive. So if you have a family of, a few children, two of the children may not respond negatively to the parents teasing, for instance. They may find it playful and fun, whereas this one kid is extremely wounded by it. And so anything that hurts somebody's feelings or makes them feel inadequate or unsafe is going to be more profound for someone who's very sensitive. And so they come into our group, and every last one of them is in the same boat in that way. They're all sensitive. And they have a sensitivity to each other that helps us as clinicians to be very mindful of that as we interact with them. We watch how they treat each other, and we, can take a lot of cues from that.
Yes. I just read about that, and I'm reading the best book, Childhood Disrupted. And in that book, the author's name is Donna, but I can't remember her last name off the top of my head. But talking about that some people are more sensitive than others, and it's not just that it's something that they can control. It's the circuitry of their brain, how things developed. So having that understanding that, hey, somebody is not only going through this, but they kind of think like me and respond like me to situations. So tell us, what are the various types of eating disorders?
Well, the primary eating disorders that people come into treatment for are anorexia nervosa, which is, there are a couple of different types, but basically the primary factor is self-starvation and a body image distortion where they see in the mirror someone who is much heavier than they actually are. Bulimia nervosa is someone who can often be of normal weight, but they restrict what they eat, and they also binge and then will purge in one way or another. Purging meaning that they try to get rid of the calories that they have consumed, either through self-induced vomiting, laxative abuse, sometimes excessive exercise, but the motivation being to get rid of any, excess calories that they've consumed. And we also see a lot of people with binge eating disorder, which is exactly what it sounds like, people who eat large amounts of food in what feels like an uncontrolled way, and without the purging that comes with bulimia. There are other eating disorders as well that are not, that don't reach the diagnostic, the level of diagnostic criteria, but they still cause distress. And one is nocturnal binge eating disorder, where people get up sometimes repeatedly at night and eat. Sometimes they don't even remember having eaten until they find the trash, in the trash can. There's a term, orthorexia, which refers to people who begin by trying to eat healthily, and that could be clean eating or organic eating, or in some way, following what they believe is a very healthy style of eating, until it gets to the point that they have eliminated so many types of food that they become malnourished. And so instead of being healthier, they become, less healthy.
Yes, and there's definitely the psychological component, but it really meshes in with that physiological piece too.
Yes, because once a person gets to a certain place in an eating disorder, then the eating disorder takes over, and it's no longer a choice. And that is the thing that's very scary. Sometimes, people, nobody sets out to have an eating disorder. They start off altering how they eat or exercise for a specific reason, and usually it's to be healthier in some way. And then those who are genetically more vulnerable can develop an eating disorder, and before they know it, they are stuck with it and have a very difficult time letting it go.
Yes, it just kind of rolls out of control, and then it's more than just that feeling of something you can kind of power through recovery yourself. You need expertise. Now, I know when I first started working with clients with eating disorders, I reached out because I'm an EMDR therapist, and I really wanted to see if that fit in that model. And one thing that Marnie Davis she's in Orlando, and she treats them with EMDR and the feeling state protocol, which I eventually used that as my approach. But she said that it is so important to collaborate as a team, because the therapist does really helps that psychological aspect, but then you need a nutritionalist on board, and then you need a physician to do blood work and really look at that health component. And I know that the team approach is definitely a biggie for you. You have like the most amazing practice. Could you speak to that a little bit about the teamwork and when it comes to helping clients with eating disorders?
Yes, I think that is in my view, and I think this is borne out by research, that a team approach really is the gold standard.
Mm-hmm.
It is in an outpatient setting, it is sometimes difficult to achieve. But as you had mentioned earlier, we do have a registered dietitian here on site who works with eating disorder clients. And so the way that we operate is that a client may come into our practice either through the therapy side of things, so they may make an appointment with me first, or they may come through Sarah, who is, our dietitian.
Mm-hmm.
And either way,
her.
Yes, she's
great.
And clients love her too. I
Yeah.
had someone stop by my office on their way out this morning to tell me how much they loved working with her. So, that says a lot. People are often afraid to see a dietitian. They're afraid that they will put them on some restrictive diet, or else that they will make them eat things they don't like. And so sometimes we need to do a little nudging to get people in, to see her. But we each have our role on the team. And so the therapist tends to be the person who coordinates the treatment. And that's not always the case, but it usually is. Mm-hmm. And then we have the dietitian who works with people to craft an eating style that will help them achieve nutrition recovery, as well as, whatever their body's healthy weight needs to be. And since she has the scientific background in all of that, she is the one to, help determine those things. The
Mm-hmm.
physician can either be a family practice doctor who the person is seeing. It may be a pediatrician in the case of, an adolescent. And we sometimes will have a psychiatrist on the team as well, depending on whether or not the person needs any kind of medication. But of course, the physician's role is to monitor their heart function, lab work, to help us monitor progress. They will, order all of the, the bone density scans and things like that we as non-physicians wouldn't have access to. But
Mm-hmm.
probably the most important thing about the team approach is that you have trained professionals who are all saying the same thing.
Mm-hmm.
Because people with eating disorders are out there, especially if you're looking at high school students, are all out there hearing their peers say, well, I don't eat carbs, or I'm only 80 pounds, or I believe
Mm-hmm.
you should run 12 miles a day. And so these folks come in to us, and we, they're hearing all of those messages out in the world.
Mm-hmm.
And we may be the only people telling them that those things are harmful to them. And so, if it's just me or just Sarah, sometimes our voices aren't strong enough to get the message across.
Mm-hmm. Yeah, when they hear it across the board, across their team, then they start to take note. I know to all of my clients, I offer, if they have a meeting with another professional, that I could join them. And some of the clients take me up on it and some don't, but I've been to doctor's appointments with them, and it's really neat to have that collaboration. But also clinicians can definitely have the client sign an exchange of information form, authorization of exchange of information, and have that communication, even if it's via phone, with the other professional, that can take their treatment to another level.
Exactly. And I think that and that is often how we do it, is either through phone or even through just written information. And one of the things that I do and that our dietitian does as well is sometimes just provide a lot of education to the physicians, because, not every physician has knowledge about these things. There are so many things physicians have to learn in medical school. Eating disorders may not have come on their radar. And
Mm-hmm.
so even the most well-meaning doctor, if they don't have information about it, they may not know what to look for or even what medical test to order. And so that's where, Sarah and I can come in to just provide some education about, these are the things that we're looking at and these are the things that we need. And generally speaking, we have, a lot of cooperation and, collaboration with the physicians that we work with. And so I think the patients feel much more, in good hands that way when they know that we're all on the same page and, they're not being given conflicting information.
Yeah. And, I think it's real important to think of it as a community approach too. Reach out to certain clinicians that you feel like has a really good understanding and keep them on your referral list so that when a client comes to you and they need a good referral, you can really say that, okay, this is someone that I've worked with before and someone that I feel like has a good understanding of what you're going through from the medical perspective or from the psychological, if they go to a psychiatrist or the, of course, you have the nutrition or dietitian on board, but just reaching out to them without any client and letting them build that community. And then you could kind of, vice versa, let them know what you do so that they have a therapist that really knows how to help their clients that come to them, their patients that come to them needing therapy for eating disorders, because it's not necessarily things that mimic other disorders. You really have to have that specialized knowledge to really do that treatment justice and help the client in the best way.
That's true, and we do keep a list of professionals in the community whom we have either worked with or have gotten good feedback from our clients about. And we keep that list handy so when someone calls our office, it may be that we don't take their insurance, for instance, or that they live in a different part of the county and would rather not drive this far. And so that's one of the jobs of our receptionist is to provide those referrals to people when they call, just in case we are not the best match for them.
Yes, yeah, because ultimately it is about the client. Whatever that person needs, give them the very best care that they can possibly get. And sometimes that means like referring them out or, pointing them to, okay, I may not be, you may be better served by this professional. Just really looking at it from what's best for the person. Now, I know this is a biggie, that fear of recovery, and we talked about a little bit before, that really the paradox. The client's coming to you as a clinician to help them with their eating disorder, but there's a real big fear of, if I recover from my eating disorder, that means this. Can you speak about that a little bit, that fear of recovery?
Yeah, I think it is probably the one factor that makes treating this population the hardest of all. If you think about somebody who has depression or anxiety, nobody wants those. And that's not to say that people who come into treatment with anxiety, for instance, can immediately do the things that will help them. But they don't want it. They want that out of there. They want to feel different. They don't want to feel anxious. But because an eating disorder is a lifeline for a lot of people, it is actually more of a tool to manage other feelings such as the anxiety or depression or grief or loss. And so we're asking people basically to do without their safety net. And as we touched on a minute ago, when an eating disorder has been in someone's life for a long time, it becomes intertwined with their personality, and they have a very difficult time even imagining who they would be without it. So we're asking people to let go of something that did serve a very important function for them at some point. However, now it is no longer serving them, and it's become the problem itself. What I tell other clinicians when I'm giving presentations about this is that, especially someone with anorexia, but even with bulimia, we're basically saying to this person, we can help you feel better, but then you must become obese.
Yeah, and which is
that is
scary for them.
Treatment.
Hugely.
Exactly.
I mean, and their version, their view of obese may be like a normal weight for someone else.
Precisely.
So distorted.
Right, but that's what they hear, that there is one way for you. One of the side effects of our helping you get well is that you will have to be at a weight that you think that you will hate. And so I try to put that into perspective for other clinicians. So if you go to your physician and you have some chronic health condition, they say, well, sure, we can help you, but then you will now have to become obese for the rest of your life. I think a lot of people would think twice before they would jump on that.
Absolutely.
And, clearly we know that that isn't exactly what we're asking them to do, but in their distorted perspective, that's how it feels. So one of the things that we also know is that recovery from an eating disorder takes an average of 4 to 7 years with good treatment. So that's one of the reasons it takes so long, is because we're really having to untangle a lot of pieces of the person's identity and the way that they cope, and helping them replace those pieces with things that are more adaptive and healthy. And, so there's a lot of stop-start, a lot of fear, a lot of, coming in and out of treatment. And so those of us who are in the field one of our greatest skills is patience.
Yeah. Yeah. And I think what you're really speaking to is it's not just a matter of getting them to eat more. It's not a matter of getting them to eat less. It's not a matter of getting them to quit vomiting after they binge. It goes much deeper than that. And I know the filling state protocol that I use, it really looks at what is it giving you? And then when you can, is it giving you acceptance? Is it giving you a feeling of control? What is it giving you that, and then working with that piece can really help that fear of recovery too. But it is a long process, but it's worthwhile because there are so many things that, like if an eating disorder continues untreated, it can be really bad. It can even lead to death. Can you speak to that about untreated eating disorder a little bit?
Well, one thing that we do know is that eating disorders tend to be progressive. So it means, that they get worse over the years instead of better when they're not treated. They can become chronic if they aren't treated. It's sort of like many other things like cancer. We know that if cancer is detected early and treated early, that recovery is very likely, and that people can be cancer-free for many years. And the eating disorders are similar in that if they are caught early and treated early, then they don't have to become chronic. But a lot of times, by the time people get into treatment, they've already had them for many, many years. And so that complicates the ability for people to let go of those.
Yeah. Yeah, and it's a complicated process, but it can and it does work. They just need to find somebody that's qualified to do it with passion and patience, and get that team approach. Now, I know it does require really good understanding and training and things of that nature. I know you sent me some great information to put in our show notes, but for those people that are just listening, maybe on iTunes or Stitcher Radio, that may not be able to go to the website right now. Can you talk a little bit about the trainings, maybe some trainings that you've had or certifications to really get that depth of knowledge that is necessary to help these folks in a way that really makes a difference?
Well, in the last, let's say, 6 or 8 years, I would say the most beneficial training I've had has been through the Renfrew Center, which was the very first residential treatment center in the U.S., and they are down in South Florida. They're all over the place now, but they have an annual conference in Philadelphia that is several days long, and then it looks at many different aspects of eating disorders, including trauma, impact, and relational issues. The other source of information that I have found, probably just the most profound source so far, is through the Eating Recovery Center, and they are located in Denver. And it is a physician-owned hospital system. So they have just enormous resources to do a lot of research, as well as be very flexible in terms of, changing their protocols as soon as, when they realize what they're trying to do doesn't work. And I have found their trainings to be very just cutting edge, both from the medical point of view, but also from the psychological point of view. And they offer regular webinars, both for professionals as well as family, friends, and patients. They're just very user friendly, and you can access information on their website at any time. But they just have the premier clinicians in the world working there, and I've just been very impressed with their programs.
Oh, that's awesome. And I love that you can do it online. I know a lot of the listeners here are listening, not even from the United States, from all over the world. So you can just get on those webinars and get the information that you need. And a lot of times it qualifies for CEU, so you can get your training credit for that year as well through that. And really, really, truly become an expert in helping these people get better and live a better quality of life. Because I know the eating disorders really consumes their thoughts. It's like takes away that ability to be present in other situations. It's like consuming.
They have the eating disorders actually have the highest mortality rate of any psychiatric disorder, and they, as I was saying a minute ago, because they're progressive, people who have them for years become more and more and more isolated from other things that they value in life. And that is one of the treatment interventions that I use, is trying to help them recognize the function, like you were saying a minute ago, and replace that function with something healthier, but also to look at their personal values and what the eating disorder has cost them. And whether it's, in interpersonal relationships, or being, the kind of mom they want to be because they're so, busy counting calories that they can't, sit down with their children to eat a meal, or, that they can't allow themselves to have a social life because so much of socializing revolves around food. And so the values that they could ordinarily live by, the values that in their heart of hearts really make life worth living, those get hijacked by the eating disorder. So we ask them to start to identify those things and try to align their behavior with what really matters. And they, that makes the hard work of recovery worth it. It's not much point in doing hard work for nothing.
You're not kidding. And when it does impact like your quality of life, I mean, that's not just like one or two things. That's like, I can't go out with my family for a birthday celebration because I only eat vegetables without any salt, or I don't want to feel different, or I don't have enough energy to play with my child or be with my child because I haven't had the nourishment that my body needs to function. So it really does intertwine.
So I can't wear shorts in Florida because I don't like the way my legs look. That's one thing in Minnesota, but here in Florida, it's really, it's quite a cost.
It's impactful, and I know it's so tempting, just as a human being, to think, gosh, you are like the opposite of, you're underweight, you're not overweight. But when you're working with these folks, it's very real, and it's important to really reflect where they're at. So they realize that, hey, you do understand you're not disagreeing with them. You're just kind of helping them to see and feel it for themselves, that reality. Well, we're almost out of time here. Can you share, and I know I gave a pretty in-depth bio, but share a little bit about yourself and your awesome practice, which is so unique. I would love for maybe some clinicians that are listening to this hear how you've created that team approach and just have that group practice that's helping people.
I started Beachside Counseling and Wellness just a couple of years ago. I've been in private practice as a therapist for about 20 years, but I got together with some other clinicians here in Brevard County, and we have opened Beachside Counseling and Wellness, where, as you said, we have a registered dietitian on our team. We also have 2 psychologists who specialize in different things. One person does neuropsych testing. The other one specializes in addictions. We also have another licensed mental health counselor who works with children of divorce. Mm-hmm. And we have, I have a Florida Tech student who works with eating disorder clients on a very reduced fee basis. And that's part of our mission here at Beachside Counseling and Wellness, is to mentor and train emerging clinicians so they can go into the world and have a good foundation of knowledge, to do the work, either here when they graduate or, to move on to wherever they're going to go. Mm-hmm. So we are, we have regular staff meetings where we collaborate with each other as far as, a lot of times I may work with the individual, who has eating disorder, and then say, for instance, Judy may see the parents and to help them cope with what their child is going through. And then the whole family may work with Sarah, the dietitian. Mm-hmm. We have, everybody in the group may have some piece of the, of the family that we work with. And that way, once again, we're all kind of saying the same thing, but giving a broader support, because one of the things that we also know about eating disorders is that caregivers can suffer the same kind of compassion fatigue that folks dealing with someone with Alzheimer's or cancer can experience. And this goes to what you and I have already said about the chronic and difficult nature of these disorders, that the people caring for them suffer greatly as well. And so we do encourage family members to get their own support and treatment because they need it.
Yes, and I think the fact that the child can come see one and then go to another person in your office, like the child come see one of you guys and the parents come to see someone else for parenting strategies, can take it to the next level too, because sometimes as a parent, it is so hard to know how to respond in a way that's helpful. And it can be tempting to make comments that are maybe triggering and make it worse. So the educational piece is a biggie, or just helping them deal with the fact that this tough thing is happening in our family, and how can we get through this? Really giving them that.
It's very
therapy.
Painful.
Yes,
There's one
it's
other
scary.
thing that we do, and that is that on about 4 times a year or so, we offer a free seminar for family and friends. I did want to mention this. Our next one is coming up May the 8th, and it's free for anybody who is interested in this. It's from 6:30 to 8 p.m. And we talk about the myths and facts of eating disorders, how to be supportive without losing your mind yourself.
Yes.
The importance of self-care and boundaries, but also we've done this about 4 times now, and the people who come also use it as an opportunity for a support group. So they are parents of folks who have eating disorders, or they might be a sister or, a husband or, other significant other, and they sort of share some of their stories with the other people who are there. And so not only do they get information from us about eating disorders, kind of the basics, and what's entailed in treatment, et cetera, but also they get some Me Too's, from the other people who are attending, and oftentimes they'll exchange phone numbers to in case they need support later. But we're finding that to be just a very positive thing for the community. And each time we do it, we have a few more people. So, and we enjoy it because we learn a lot as well from them about what they're dealing with at home.
Yeah.
That, we hear the client's point of view, but we get to hear what other family members are dealing with. So that gives us more perspective.
Absolutely. I know I wanted to go to the last one, and I think my daughter was sick or something. I was like, man, I missed it. but I'm excited to go to the next one. And for those of you who are listening that are not in the Central Florida area, that's in Cocoa Beach, Florida, where she's referring to. So we live in an awesome area, don't we, Lucy? It's beautiful here.
Yes.
Mm-hmm. It's like paradise. Hate to brag, but it is very nice.
Mm-hmm.
All right. Well,
yes, I went swimming this weekend. So.
Oh, you did? I know.
Yes,
I know. Right
lovely.
here in the beginning of April, and it is really nice. And you're close to the beach, right there with your practice, beachside counseling. Mm-hmm. Do you have any social media that you'd like to share, or anything like that?
We do. We have what I would say is an awesome Facebook page. Mm-hmm. Our office manager updates it almost daily with informational articles, inspirational, messages, and info about what we're, the services and things that we offer here. And it's just Beachside Counseling and Wellness on Facebook is where you find it. We also have an Instagram account, which is the same thing. Mm-hmm. And our website is bewellcounseling.net, and that has a wealth of information as well. On the website is a downloadable article called Understanding Eating Disorders that I wrote that answers a bunch of the questions that usually come up during these family and friend seminars. Mm-hmm. So it's you can find that on our website under mental health and wellness, under the mental health and wellness tab.
I love that. As you're speaking, a quote just came to my mind that be the change you want to see in the world. Mahatma Gandhi, yes. It sounds like that's what you're living. You see all these areas of need and you're just doing it. Good for you. Good for the world to have that kind of resource.
Well, thank you. I had wonderful training and mentoring when I was first coming up in this, and I always wanted to do the same for emerging clinicians. I felt like I got so much help as a young clinician that I couldn't imagine doing this work without that. So I want to make sure that other people get it too.
Oh, I love it. And I love that I get to know you. It's neat. Thank you so much for being on the show, and I will talk to you later.
Okay. Thanks for having me.
All right. Bye-bye.
Bye-bye.
Oh, I hope you enjoyed that conversation as much as I did. I have a lot of respect for Lucy Lauer. If you would like the show notes for this episode, go to playtherapycommunity.com, and there you can sign into the newsletter as well, get a free video downloaded of me telling you about my favorite miniatures that I use in sand tray therapy, as well as a look at some resources that I love. I love labyrinths. I love weighted blankets. And as far as a note-taking program that I use for my practice, Theranest, I love that as well. So you can find out more about that at playtherapycommunity.com, and I would love to have you in our Facebook group. It's a closed Facebook group. It's called Play Therapy Community. You could just do a search for that inside of Facebook, and we also have a page, so you could like that page and get alerted to all of the new episodes coming up. I'm super excited about, at this time, I'm having an app created too. So you can just have access to the podcast episodes right there on your mobile device. Well, thank you so much for listening. And until next time, take care.
To join our growing community for free, just go to playtherapycommunity.com and find us on Facebook too.
Thanks for listening to the Play Therapy Community Podcast. Until next time, bye-bye.